here in this state, we have not only 19 pueblos who not only speak Keres, Tiwa, Tewa, Towa, and then those dialects within themselves, but we also have the Spanish-speaking population and like a Vietnamese-speaking population. And you actually come across times when sometimes the interpreters aren't available and you have to sit there and wait, and it backs up everything else. And it's just an interesting system, I think, to be practicing medicine here in New Mexico.
I think the latest statistics show that there are about 60% of Native Americans now live off the reservation and are living in cities like Albuquerque, Phoenix, and Denver because of proximity to jobs and education and so forth. I think the transportation barriers are still present here within urban communities, especially because of things like public transportation and access to regional transportation. Those also pose barriers, not just for Native communities here in the urban area, but also Latino and other low-income community members as well.
In addition to those barriers to access, there's also a tremendous lack of infrastructure in a lot of the communities, and what that ends up doing with respect to healthcare is really increasing that burden because of the need, an example of people who are hauling drinking water, which is not at all uncommon here. And especially on Navajo communities, there's about 35% of people that don't have access to regulated water systems. And so just the amount of time it takes every day to get water in and to get wood in to build fires, and then you add having to travel 400 or 500 miles to get health care.
In my experience, culture is almost never a barrier. So when people say, oh, culture is a barrier to help seeking and health setting, it's really what they mean, if you look into it more deeply, is that the healthcare setting is not inappropriate. There is a mismatch between the culture, or there is something else completely going on that is blocking people from having access to care, only to later come back and say, oh, this community has a culture as a barrier. It was really rarely like that.
There's a lot of mistrust going on in our communities with our healthcare systems and hospitals, just based on prior history from a family that may have gone to the dentist and got the wrong tooth pulled out, and that carries down from generation to generation. And it's really hard to overcome those stories that you hear from your family. So, I think the healthcare system is getting better, but we have a long way to go.
Just because I'm Native and just because I'm from a different tribal community doesn't mean I'm readily accepted. There is a huge mistrust of research in these communities. With the Apache community that I have been working with, actually it's been for 10 years now, when I initially went to the Tribal Council to talk about a research study, a National Institutes of Health funded study by the National Institutes of Drug Abuse, the comments I got were, we already know we have 10 fingers, 10 toes. What other kind of research do you need? So they were used to different types of research, and because of the mistrust and misuse of research, those are long memories and stories.